my name is Morgan Nelson. I'm a student nurse with the University of Memphis. Can I please have your name and date of birth?
Brandy Person, August 5th, 1976.
Okay, today I'm going to be assessing your neurological and musculoskeletal system. First I'm going to be assessing your orientation, so can you please tell me your full name?
Brandy Elise Person.
Okay, can you tell me where you are?
I'm at home.
And can you tell me today's date?
April 16th, 2020.
Okay, patient is alert and oriented to person, place, and time. Now I'm going to be assessing your pupils, so if you could just look straight ahead for me. Okay, and just looking at the pupils. Pupils are round and react bilaterally to light. Upon rest, they are 4 millimeters, and then upon constriction, they are 3 millimeters. Okay. Now I'm going to assess your upper body strength. So could you please just squeeze? Okay. Grip is strong and firm for upper body strength, and then can you press against? Okay. Lower body strength is firm. Okay, now I'm going to be assessing your spine. So could you please stand up for me? Okay, you can turn this way more. Okay, just looking at the cervical spine, palpating the spine. Okay, could you please bend forward for me and touch your toes? Okay, you can stand up. The spinous process is straight with proper alignment. The cervical and lumbar spine is with concave curve. There's no kyphosis or scoliosis. And then the lumbar spine is curved convex upon forward bending to touch the toes with no lateral curvature. Okay, now I'm going to be inspecting your muscles, so you can sit down. Okay, I'm going to inspect the trapezius. I'm going to inspect her biceps and her triceps, and on her right side as well. And then quads, can't see because of the clothing. And then your calf muscles, on the right I can see, and on the left. Okay, upon inspection of the trapezius, biceps and triceps, quads and calves, the color is even and appropriate for ethnicity. There is no swelling or deformities present. Okay, now I'm going to palpate your muscles, and if you have any tenderness, just tell me. Okay. Palpating the bicep and the tricep on the right, and now on the left, the bicep and the tricep, quads, and the calf muscles. Okay, the trapezius, biceps, triceps, the quads and the calves are all symmetric bilaterally. They are also, there was no masses palpable. There was no heat or tenderness also as well, bilaterally on all the muscles. Okay, now I'm going to inspect your joints. So I'm just going to feel on your joints. The right. And now your elbow and your wrist. Okay. Inspecting the elbow on this side, wrist, and then the fingers, and then the fingers. Okay. And then can you bend your knee for me? And this one, and then your ankles. Okay. Upon inspection of the joints, the color is even and appropriate for ethnicity. There is no swelling, redness, or deformities present. Now I'm going to palpate the joints. Bend for me. And turn the wrist over. Spread your fingers. Shoulder. And turn this over for me. And your fingers. Okay, and then if you just bend your knees one more time. Okay, and then you can put them down, and then your ankles, can you just kind of roll them around for me? Okay. Perfect. Okay, upon palpation of the joints, there was no heat or tenderness, there was no masses palpable, and that's about it for the joints. Okay. Now I'm just going to be testing your range of motion.
Okay.
I'm going to be demonstrating like some motions, and then you can just follow as so. So for the first, we're going to be inspecting your neck. So for flexion, you're going to bend this way. So touch your chin to your chest, okay? And then for extension, look up at the ceiling, okay? And then for rotation, try to touch your chin to your right shoulder, and then to your left shoulder. Okay, and then yes, and then for lateral bending, try to touch your ear to your shoulders, and then on this side. Okay. Any tenderness with that?
Yes. But it's been that way for a long time.
Okay.
So I'll see a chiropractor.
Okay, thank you. There was upon flexion, extension, rotation, and lateral bending of the neck, there was a little bit of pain, but the patient stated that she sees a chiropractor, and there is full range of motion. Okay, now I'm just going to be assessing your shoulders. So if you could just stand this for this one.
Okay.
So for, can you see DJ? Okay. All right, for flexion, you're going to raise your arms up all the way. Okay. And then for extension, just try to raise them this way. And then as far as you can for hyperextension. Okay. You can, for abduction, we're going to raise this way. Okay. And then adduction, bring them back down, kind of pull them in. Okay, and then for, oh goodness, what am I trying to say? Oh, for internal rotation, you're going to bring your elbows up as far as you can and try to touch this way. And then for external rotation, just put your hands behind your head. Okay, all right. Upon, you can let your hands down now. For the shoulders, upon flexion, extension, abduction, adduction, internal and external rotation, there's full range of motion, and there was no pain, and the movement was smooth, with the neck as well. Okay, I'm going to assess your spine now. So for, we already assessed, but I'm going to ask you to perform a series of, so could you laterally bend to the right this way, and then laterally bend to the left. Okay, and then can you rotate this way? And then rotate the other way. Okay, and then can you try to extend, hyperextension? Okay, any kind of some pain?
A little bit.
Okay. Patient says that there is a little bit of pain, but there is full range of motion, and she does see a chiropractor for that as well. Okay, and you can lay on the bed. Now we're going to assess your hips. I'm not going to lay that way. just watch my motions. So we're gonna start with the flexion of the right leg. So just bring it up and then bend it. Okay, and you can rest your foot down on the bed, and then can you externally rotate it, internally rotate it as far as you can. Okay, and then you can lay your leg straight. Can you abduct your leg? So you're going to bring it out to the side and then adduct it and bat it and bring it back in. Yes, exactly. Okay, and then for your left leg, do the same thing. So flexion, raise it up, and then bend it at the knee. Okay, and you can put your foot down. Then you can internally rotate it and externally rotate it. Okay, and you can lay that leg straight, and then can you abduct it for me, and then abduct it. Okay. All right, now I'm gonna have you stand up so we can test your hyperextension. So if you need to, you can just like rest your hand here. But what you're going to do is just raise your leg as far as you can naturally without leaning forward, just straight.
Oh, okay.
Yes. There you go. Okay, on the right and then on the left as well. Okay, thank you. All right, you can have a seat. Was there any pain with that for your hips?
No.
Okay. Upon testing the range of motion of the hips, upon flexion, there was hyperextension. We also tested the abduction and abduction along with the external internal rotation with the knee bent. There was full range of motion, and the movements were smooth and there was no pain. Okay, that's all I'm going to do today. Is there anything else I can do for you before the doctor comes in?
No, ma'am, I think I'm good.
Okay, thank you so much.